G20 held gathered in Yogyakarta to begin the discussion on increasing the financing for tuberculosis. The discussion continued on the sidelines of UN General Assembly in New York last September. And I'm proud to say that we have reached a positive result, which we gain support and attention from high-level G20 countries and other countries, international organizations, partners, and civil society. And today, let me share with you on one of the outcomes of the discussion. The call to action began by describing the current situation in TB and unmet investment needed to eliminate the epidemic. The text then elaborates on acknowledgement and reaffirmations from G20 countries in effort to end TB. The documents end with 13 calls to action. These 13 calls to actions emphasize the following issues, which are mobilize adequate, predictable, and sustainable resources to close the funding gap. Second point is integrate the TB response within domestic and international financing. Support and enhance the application of existing multilateral platform and funding mechanism for safer, more effective, and affordable TB vaccine, diagnostics, and treatment regimens. Foster multi-country collaborations for undertaking TB research. Enhance community engagement and engage with public and private partners. Recommended rapidly transitioning to real-time surveillance data. And during G20 leadership to end TB sessions, speakers highlighted how strong political commitments and multilateralism can accelerate the deployment, and implementation of novel solutions in COVID-19 response. Such collaboration is needed to overcome TB through a people-centered approach by abolishing stigma or any form of prejudice and addressing the needs of communities for quality services with human rights-based and gender equity principles. This call to action financing for TB response that have been resulted to all G20 members countries hope to be adopted tomorrow as the outcome of the G20 Health Minister meeting. And we thank all countries, stakeholders, partners, and also the media who have supported this conference. And also we can't make this a successful event without all of your kind effort and support. The commitment I have witnessed during Indonesia presidency in G20 give me great hope and confidence that together we can promote health, keep the world safe, and serve the vulnerable. I think that's all from me, Dr. Ajir. Back to you.
Thank you very much, Mr. Imran. And we continue to hear from Dr. Suvanan Sahu as the Deputy Executive Director of the Stop TB Partnership, which is a UN-based global partnership against tuberculosis. He will join virtually in Geneva. He is a medical doctor and public health expert within over 25 years old experience, working at country, regional, and global levels. And he passionate about universal access for TB prevention and care, access to new tools, innovation in a care-free and people-centered approaches. And I will give the floor to Dr. Suvanan Suhu to speak a few words. Dr. Suvanan, the floor is yours.
Thank you. I bring greetings from the Stop TB Partnership, We are a United Nations-based global partnership with a vision of a TB-free world. I am grateful to His Excellency, the Honorable President of Indonesia, Honorable Health Minister of Indonesia, Ministry of Foreign Affairs, and everyone else involved for inviting us to the second G20 Health Ministers meeting in Bali. For me and the wider TB community, G20 under the presidency of Indonesia has been unique because for the first time ever in the history of G20, tuberculosis was given its due recognition. I congratulate Indonesia for this leadership it has demonstrated. We must remember that TB can be prevented, diagnosed, treated, and cured. There are tools available to do this, and more tools are in the research pipeline. Yet, the world has allowed this disease to grow so big that it has become the biggest killer amongst infectious diseases, second only to COVID-19 in recent years. There can be a number of reasons for ending up in this situation, but the biggest reason is that the fight to end TB lacks financing, both domestic as well as international financing. Because of the lack of funding, existing tools to fight TB are not reaching all those who need them, and new tools are not fast-tracked through the research pipeline. To tackle this, in March 2022, a side event was organized that led to the development of a call to action on financing for TB response, led by the Indonesian G20 presidency in consultation with G20 countries and in collaboration with the World Health Organization, Stop TB Partnership, the Global TB Caucus, the Global Fund, USAID, World Bank, and the national level Stop TB Partnership of Indonesia. You heard from Dr. Imran the contents of this call to action. The G20 alone carries 50% of the global TB burden. G20 countries together are a formidable economic powerhouse of the world. We know that. And with great potential for financing their own TB responses, as well as financing and contributing their capacities for public good for TB, such as research and development of new tools for TB, which can benefit the whole world. For this to happen, we need political commitment. And I again thank Indonesia for having championed this in G20 in 2022. To end TB as a public health challenge by 2030, as envisaged in the UN Sustainable Development Goals, we, along with our partners, launched one of the most detailed documents. It is called the Global Plan to End TB 2023 to 2030. This document provides detailed costing estimates and anticipates the priority actions that will be necessary to end TB despite the setback in the wake of COVID-19 pandemic. We are pleased to see that the global plan informed the G20 discussions on TB. It is the document that should also inform commitments to be made in the upcoming second UNHLM on TB in 2023. Indonesia, one of the highest TB burden countries, has demonstrated exemplary commitment to end TB by placing TB high on the health agenda and giving it a priority status. Indonesia has set the benchmark quite high for all the upcoming presidencies of the G20. And as Indonesia prepares to hand over the G20 baton to India, we are eagerly looking forward to the G20 presidency of India, and we will work closely with India to ensure that TB remains high on the political and global health agenda. The Honorable Minister of Health of India is also the chair of the Stop TB Partnership Board, and we are looking forward to his leadership in 2023. Let me end by asking you to reflect on this. TB is a disease that has all characteristics.
Yang memiliki semua karakteristik tersebut.
Can I continue?
Yeah, Mr. Swan.
Yeah, TB is a disease that has all these characteristics. It is an airborne infection, has resistant variants. Close to 2 billion, not million, 2 billion people on the planet are currently infected with the bug. Over 10 million people each year fall sick with the active form of the disease. A staggering 15% of them die. 15%, 1-5. Over 1.5 million deaths each year. Testing, treating, contact tracing, airborne infection control are some of the tools to fight the disease. And we know that an effective vaccine is needed in the end game. Doesn't it sound very similar to COVID-19? G20 countries fought COVID-19 with unprecedented speed and scale of mobilizing resources, capacities, and public health action. So why can't it happen for TB as well? The people affected by TB need urgently the leadership of G20, and we are glad that in the G20 in the year 2022, under Indonesia presidency, this process has begun. Thank you for this opportunity. Over.
Thank you, Mr. Suvanan Sahu. Explain about the financing needed to fund TB response by 2030. And then the next speaker, we will hear from Mrs. Nurul. Mrs. Nurul is the head of Stop TB Partnership Indonesia Foundation. She is currently serving as one of the organized signatories of the principal recipient of the Global Fund TB program through Community Consortium, Penabulu STPI, and a part-time consultant for the World Bank. She was trained a physician and continue to contribute as a public health advocate in tobacco control, primary healthcare, tuberculosis in Indonesia through national and international engagement. The floor is yours, Mrs. Nurul.
Thank you, Mr. Moderator. So I would like to share a bit about Stop TB Partnership Indonesia. So we are an Indonesian organization with a vision to end TB, hopefully in 2030. And we believe that the elimination of tuberculosis in Indonesia can only be achieved through a strong partnership between government, private sector, and civil societies. And we started as a forum in Indonesia since 2013, serves more than 120 organizations and individuals who are actively involved in TB response in Indonesia. And the work and the fight against tuberculosis has started long ago, maybe too long. And we see in Indonesia that the investment to accelerate the effort to actually eliminate TB in 2030 is needed yesterday or 10 years ago, actually. But we see that currently, with the strong leadership and the political commitment that we have under the current government is very strong. Indonesia itself, we just launched the presidential regulation in tuberculosis. We've been fighting through with that ever since Pak Imran was still in the TB program, and the regulation was launched in 2021, and it creates a unique opportunity for Indonesia while being the presidents of G20 this year, because then Indonesia can put TB in the highest priority. And also for the first time, as mentioned by Dr. Sahu, now Indonesia put tuberculosis in the G20 agenda for the first time ever. And it resulted in a call to action document on TB that highlight the importance of financing for TB to end the TB in 2030. And why is that needed? Because for Indonesia itself, I mean, like even for the G20 global countries, 50% of the burden in global are held in the G20 countries. And for Indonesia, if there's no significant investment, the loss could be up to 1.6 trillion rupiah between 2020 to 2050. And the longer we treat or invest in TB, it's going to be more costly and costly. The current investment needed to end TB is actually only less than 2% than the potential economic loss that we're going to hold if we just do business as usual. But again, the call to action that going to be launched tomorrow on TB needs to be translated into action that really increase investment in TB care and prevention, as well as for research and development. Because currently, the financing for TB is not enough. And if sufficient and sustainable financing solutions in the context to achieve universal health coverage are available, countries, including Indonesia, can recover stronger to build TB response that can strengthen its health system as a pathway to also enhance the pandemic preparedness and response within the global health architecture, the discussion that had been going on during the G20 meetings. So my last statement would be, although the COVID-19 pandemic may has jeopardized progress to end TB, this is also an opportunity for us to do better in ending the epidemic and also to increase the investment to end TB. We hope that this great initiative will continue to India's G20 presidency and acts as a reference point for countries on the upcoming UN-HLM meeting in 2030. Thank you.
Thank you, Mrs. Nurul. Now we will start the question and answer. Before that, I will highlight 3 points that guided us to discuss the press conference this morning. The first one, we hear that call to action on financing for TB response from Mr. Imran, and then how to fulfill on the finance needed to fund TB response in the context of UN HLM 2023. And then the last one, how to elaborate on need for integrated TB response. We start the question and answer, and then you can introduce yourself, your name, and from what media.
Good morning. I'm Intan from Harian Kompas. I have 3 questions. One question for Stop TB Partnership, and one question for Pak Imran. First one, for TB Partnership, Stop TB. What are the biggest challenges for Indonesia to fight tuberculosis, including drug-resistant TB, which may be different from other countries? And what should be done to address these challenges, especially after the COVID-19 pandemic? And the second one, how do you see the commitment of the G20 countries to fight tuberculosis? And the question for Pak Imran, can you explain, is Indonesia also doing research on TB vaccine? How is it developed, and what are the expectations of this vaccine? Thank you.
Thank you, Mbak Intan from Kompas. Yeah, we will answer the first one for the Sufanan or Mbak Nurul. Okay, Sahu.
Yes,
First question, the biggest challenges and what should be done, and then the second one, commitment G20 country to fight TB.
Thank you. On what are the biggest challenges for Indonesia? And you also talked rightly that the COVID pandemic was a setback. Not just Indonesia, but most high TB burden countries globally, we see that the current urgent need is to recover from the impact of COVID-19 pandemic. And what does it mean? In the COVID-19 pandemic, less people with TB were diagnosed and treated. That means a lot of TB remained in the community undetected. Now that has to be reversed. That means more people have to be screened, tested, and diagnosed for TB. That is the most urgent and important challenge that Indonesia, not just Indonesia, but most other high TB burden countries face. That's the urgent need. Once the recovery happens to pre-COVID level, which should happen quickly, we should move even faster than in the past, because the incidence of TB has to decline at a much faster rate in Indonesia, same as in many other high TB burden countries. And for that, we will need a comprehensive strategy, which Indonesia has, of diagnosis, treatment, as well as prevention. There are tools to prevent TB. All of them have to be combined and implemented as a comprehensive package. And for that, very important that the financing has to be made available so that it has to happen at scale. It should reach everybody in need of diagnosis, treatment, and prevention. And knowing Indonesia, the country with so many provinces and decentralized governance and islands, that is a challenge which I'm sure Dr. Imran and others are thinking about, and they have a good plan, I must say, to do that. But let me end by the answer of this question by saying that Indonesia is a country where you heard there is a presidential decree on TB. If that kind of a head of state level leadership is there, I personally believe that it is possible to implement unprecedented actions to end TB by 2030. Now, let me go to the second question, if I can, the G20 commitment. So G20 is a group that has been meeting every year, different presidencies. We have never had the situation where G20 focused one day or more in their agenda on tuberculosis. In the past, communiques of G20 health ministers and heads of state, if TB was mentioned, it was mentioned as a word in the context of AMR or something else. But this is the first time, as I think many of us said, that under the Indonesia presidency, TB has been a priority within the discussions. There were several meetings held on TB, and that shows that Indonesia has managed to make TB a priority agenda within the G20. We hope that this legacy should continue, and we are very confident it will continue because, as I said, next year is India presidency, and after that is Brazil presidency. India and Brazil are both high TB burden countries and have championed TB in the past. So I think the stars are aligned for G20 to have further commitment on this. Thank you.
Thank you, Mr. Sahu. Mrs. Nurul, is there any edit on?
So I would like to add on the question. Well, I would like to add from the point that Sahu made that the challenges is we need to speed things up. And why we need to speed things up? Because for TB infection, if the treatment get delayed or undetected, it will make the treatment longer and more difficult. Like you mentioned, the multi-drug resistant TB. To treat a patient with multi-drug resistant TB, it costs about $3,200 per person, compared to treating patient with drug susceptible TB, it costs only about $48. And even if we can treat patient who has latent TB, meaning that they have a TB infection but not yet fall ill, and we treat them with a preventive treatment, it costs only about $1 per person. So you can imagine how, if we move too slowly, the cost of TB will keep increasing. That's why we need to act fast. and act now. Thank you.
Thank you, Mrs. Nurul. The third question about the research TB, Pak Imran.
Yeah. So first of all, thank you for your kind attention about the TB vaccine progress. Yeah. And I believe that any innovation is good effort to accelerate the TB target, both in Indonesia and global. Talking about the TB vaccine, yeah, we already know that some initiatives are already started. However, we haven't get the exact progress or exact what we call the result of this what we call the result of the vaccine progress of the implementation. So I'm sorry I cannot say that in this moment, but I will try to seek the information about this one. Yeah, because in Indonesia especially, we don't have the result, the research about the vaccine. So it's in the Europe. So I have to ask with this information to the WHO first. Yeah, Mbak Anita. And I think I want to add information also from Dr. Saw and also Dr. Nurul about talking about the principles, of how we can deal with the TB epidemic. Yeah. So nowadays we have estimated 824,000 estimated TB cases. However, now in 2022, our coverage, our notifications in September is around 54%. It means that around half of them still in our community. And if they are not notified and are not treated, so like Dr. Sahu and also Dr. Nurul mentioned, they will spread the infection. So that's why the first principle is we have to find them and treat them until success. So that's we call TOS TB, right? Temukan, obati, sampai sembuh. I think that's from me, Pak Ajir, Dr. Ajir.
Thank you, Mr. Imran. I think our question and answer will be limited to question because we have a limited of time. The last question, if there are any. No, okay. Okay, there's no question. Sahu said that for the media, this is a good link to know about the different candidate TB vaccine. Buat Mbak Intan. The last question? Okay.
Good morning. I'm Uli from Bingkai Magazine Health Policy Agency. I would like to raise a question because you said that vaccine therapeutics and diagnostic is the modalities for treating TB, tuberculosis. And as we know that those health technologies are expensive after they open in the market. So one of the issues that raised in the equities for access and delivery of health technologies is because the price is so high, so expensive, so not so the only limited populations can have the access to the health technology. So my question is how you protect and ensure the equity access of tuberculosis vaccine therapeutics and diagnostic in terms that everyone will get the same treatment, the same vaccine, and the same diagnostic after, so they will become healthier. Thank you.
Okay, thank you, Mbak Alwi. I think the three speakers can answer this question. The first, Pak Imran.
Yeah. If I'm not mistaken, you are talking about equity, for the access of TB diagnosis and treatment.
Yeah.
So in Indonesia, for the diagnosis, we already procure around 1,700 molecular test machine, and we already distribute all over Indonesia. And we also procure the reagent for this one, for this equipment is around 1.5 million per year. So it means that, and we distribute all over the puskesmas and also public hospitals. So we trying to make equity for everybody in the Indonesia, that if they suffer from TB, they can get access as soon as possible. Yeah. However, in our national strategic plan, we already calculate. Yeah. So the numbers of the molecular test is around 2,500. So it means we still need around 700 machines. Yeah. So this year we will procure another 100, and for the next year we will still asking, yeah, for the budget about to procure more and more machine. So that's the cases in every cases in Indonesia, they can have free access and what we call immediate access to them. And also for the what we call the drugs, we also procure for the drugs for drug sensitive and also drug resistant TB patients. I think it's answered this question.
Thank you.
Yeah.
Ms. Nurul?
Yeah, I think to add on Pak Imran, in providing TB treatment, I think partnership and collaboration is a very crucial part, because in TB, when a patient fall ill or diagnosed with TB, we work with community cadres to trace and track the patients, and that will create access for those who might not be aware that they are exposed to TB and might have TB, and then those surroundings would be screened for TB, and the activities is not passive. So with the collaboration between the healthcare workers, between government and the community, TB patients have access for diagnostics, for screening, and for treatment. Although at the moment, when Pak Imran said there's a 1,700 diagnostic, while the puskesmas is about 10,000. So it still need a referral system, a good referral system, because not all puskesmas has that. And there's also a collaboration with the private health facilities as well, because not everyone want to go to puskesmas,
Yeah.
right? And many patients actually they go to private health facilities first. About 70% of TB cases, the first point of care that they go is actually private health facilities. So currently the government partner with not just communities, but also with private health facilities, and at the moment also trying to create an incentives for the private health facilities, so they that will increase access to patients and to their families. So again, I think the highlight is in providing high quality TB care, we need collaboration to create access. We cannot just procure the tests or drugs, but we need active case finding. We need a active approach, and that will need a lot of support from community, also from media, to inform people that we still have a high problem in TB, and everyone should be aware and everyone should be screened or diagnosed if they have a TB symptoms. Thank you.
Thank you, Mrs. Nurul. Mr. Sahu?
Yes,
You want to add?
let me add the global perspective to this.
Okay.
There is also this issue of equity between countries, because if you are a large country with large volumes, you can procure a health product at a good price. But the smaller countries may not have that capacity. So there is a global drug facility for TB, which is a platform for all countries to procure drugs and diagnostics for TB at the same price. The price is published, and there are systems globally to reduce the price. I'll give you an example. When the new molecular test Gene Expert came, it was $17 a test. Now it has reduced to $10. There are some efforts ongoing now to reduce molecular test prices even below $10. Similarly, if a new vaccine comes, we have to work together to see that through a multilateral approach, combining volumes, there are mechanisms to reduce the price. But I wanted to let everybody know that there is a catalog for global drug facility where countries can access these products at the same cost. Thank you.
Okay, thank you. I think I will not conclude the presentation shortly because we have a limited time. We ended this discussion, and then everything has been explained well and clear. And then I hope a call to action on financing for TB response will be done well. Sorry, we have a limited time, Mbak. Thank you. Assalamualaikum warahmatullahi wabarakatuh.